With age comes wisdom, specifically wisdom teeth. So your mouth actually goes through many changes in your lifetime. And one of the major dental milestones is getting your wisdom tooth. I'm Dr. Shilpa and I'll be talking about wisdom teeth today. So let's get wise about wisdom tooth. Hello and welcome to another dental awareness session from Sweet Smiles Dental Clinic and Implant Center, Pune. I'm Dr. Shilpa Rao and I'm your friendly dentist. We practice out of Pune in Vimannagar. You can follow us on Facebook, Insta, Twitter, YouTube and every other social platform. Our aim here is to provide as much awareness about dental care and dental hygiene and dental problems as we can. I hope the videos that we make are helpful to you. Please subscribe to our channel so that you get an update as soon as we put up a new video for dental information. Let's continue with our video on wisdom tooth. So, why are wisdom teeth called wisdom teeth? Is it because you get wise because of the wisdom tooth? Or is the reason something else? So the wisdom teeth are called wisdom teeth because they appear extremely late in the mouth. They are actually the last teeth to emerge in a person's mouth. There are in total 4 wisdom teeth, 2 lower and the 2 upper. They are called wisdom teeth because when the teeth erupt in your mouth, you're already wiser than you were when you had other teeth which came into your mouth. We don't really remember when we had all the other teeth coming out in our mouth, do we? So it's called a wisdom tooth because we are already wise by the time we have our wisdom tooth coming into our mouth. So there is no correlation between getting wise and getting a wisdom tooth. But all in all, as they said, getting wise is never easy. So is getting a wisdom tooth. Most of us are not fortunate to get a wisdom tooth in their mouth very easily. So we do remember the time we get our wisdom tooth. In reality, we will never forget when we get our wisdom tooth. So that's the reason, that's the only reason why it is called a wisdom tooth. So mostly we get our wisdom tooth in our late teens or in 20s. Not that we can't get it later than that, we can. But usually it is around 17 years, it starts around 17 years of age and it continues till about 20-25 or even more than that. We have cases in which we have seen wisdom teeth coming even when the person is in their 40s, but that's how it is. So when they come through correctly, healthy wisdom teeth can help you chew and it feels normal and little discomfort. But honestly, with time, our jaw size has reduced and wisdom teeth can lead to problems if we don't have enough space for the wisdom teeth to grow. So what can happen? So if your dentist sees your mouth and the dentist says that there is no space for the wisdom tooth, what does that mean? That means that your jaw is small and it cannot accommodate the wisdom tooth in the right position that it should be coming in. And what all exactly can happen if your wisdom tooth is not coming into position? So let's see the complications or the symptoms that you feel when the wisdom tooth is coming first of all. So the main indication that your wisdom tooth is coming is tenderness. You can start having pain in that particular area. You can have red, swollen or tender gum. Okay, in that particular area, in the wisdom tooth area. You can also have bleeding gums. Okay, the second molar, the area behind the second molar can be tender and you can have bleeding gum in that area. Okay, which is one of the main signs that your wisdom tooth is trying to come. All right. The pain can range anywhere from slight pain to extreme pain. The other possible complication can be jaw pain and inability to open your mouth. Okay, so the muscles get into a trismus and opening your mouth can become really difficult. There can be foul odor or bad taste because of the bacterial growth in that area, or because of the food getting lodged between the flap, the gum flap and the tooth. This can give you a foul odor and a bad taste. So now let's get to the possible serious complications of wisdom teeth that are not coming in the right direction. The first one being loose or shifting of teeth that can happen due to extreme pressure caused by the wisdom tooth. It can spoil the alignment of your teeth. You can have receding gums. You can have sores inside your mouth. You can have persistent dry mouth. It's a terrible complication to have. Toothache. You can have tooth sensitivity because of the pressure. The pressure can also cause cracked or broken teeth. It can cause damage to the fillings or the crowns or the bridges. And your cheek might also get extremely swollen. So what happens if your wisdom tooth is not aligned well and you don't get it out? So you can have pain, you can have infection because of that particular wisdom tooth. There might be cysts or tumors that can develop in association with that wisdom tooth. Your neighboring teeth can get damaged. So one wisdom tooth can cause you to go for can be a cause for you to get extraction done for the rest of the good teeth, for the other adjacent good teeth. You can develop gum disease because of the food and bacterial growth in that particular area. You can have more tooth decay happening because of the food lodgement in that particular wisdom tooth area. So these are not good complications to have. So why exactly do we exactly have to always get the wisdom tooth removed? No, we always don't have to get the wisdom tooth removed, but we have to get the wisdom tooth removed if at all the direction of the wisdom tooth is not good, and it has a potential to cause problems to the adjacent teeth or the other tissues in your mouth. So whether partially or fully impacted, that you have to see whether the angle in which the tooth is growing is correct. The flap on the tooth has come out completely, or is it causing your food to get lodged in that particular area? Has it a potential to develop cysts or tumors, or is it causing decay for the adjacent tooth? Because honestly, wisdom tooth is similar to an appendix. It is not as much required for your daily chewing, regular chewing, but saying that it's staying there in a wrong direction, in a wrong position, can cause more damage than good. It can spoil your second molar, which is an extremely important tooth in your mouth, and it takes about 60% of the load for your chewing. So we really don't want to spoil any of the good teeth in the mouth. So as you know, I and our team at Sweet Smiles, we don't advocate extractions very easily, but saying that when it comes to wisdom teeth, extraction, if required, is a priority. Sometimes when the tooth is infected, we might have to do an extraction immediately, but a lot of times we do give antibiotics. Let's get to the part which is like the scariest for most of the patients. Let's see how a wisdom tooth is removed. I'll not do this in detail, but we will talk about it in a precise, short way, what exactly we do when we go for a wisdom tooth extraction. So first and foremost, a wisdom tooth extraction is not like any other regular tooth extraction because of the anatomy of the jaw. So there are more anatomical structures which are involved when it comes to a wisdom tooth, and the complications are higher when it is associated with the last molar. But saying that, if done well, it can be one of the simple procedures for the patient, not for the doctor, because obviously you need technique to remove a wisdom tooth. It is technique. It has to be dealt with very carefully when we have to remove a wisdom tooth, and it is technique sensitive. But saying that, in the hands of a good dentist, you will be not very uncomfortable. So let's come to what exactly we do when a wisdom tooth is removed. First and foremost, we numb the area that needs to be surgically dealt with, so that you don't feel much. It's a local anesthesia which is given, and what you will feel after that is more of a touching sensation, the pressure sensation. You can hear the noises, you can feel something is being done, but you will not feel the pain. That's what a local anesthesia does. The dentist will give in case it is completely impacted, the dentist will give an incision to the gum tissue, expose the tooth, and if it is required, they will make space in the bone, and if required, the tooth will be divided so that it comes out easily, or in toto, the tooth is removed. And then it is sutured back into place, the gum is sutured back into place, and that's about it. It's as simple as that. After the extraction, you would be given a set of instructions which you need to follow well for the first 24 to 48 hours. We will be giving you some painkillers and antibiotics which you need to take. This will take care of your infection and the pain that might happen if you don't take the medication. If the instructions are followed well and the medicines are taken in time, it is not a very uncomfortable procedure, and it's not a very painful procedure. It is you will have a little discomfort with when it comes to some pressure sensation or something being done in your mouth, but besides that, nothing very major. And with the modern painkillers and antibiotics, the after surgery healing is much better than what it used to be years back. So all in all, it is nothing to be very scared of. So please remove that fear out of your mind. And if you have to go for an extraction of a wisdom tooth, a surgery of a wisdom tooth, please go for it. Check for a dentist you trust. Check for a place where you're comfortable. Talk to your dentist about whatever fears you have so that the dentist is able to address all the fears. Don't keep the fears within yourself, because you will keep amplifying it every time you sit and think about it. So it's always better to talk to your dentist about whatever fear you have or whatever discomfort you think that you're going to have, and things would be better, it'll be clearer, and you will be more comfortable with the process and after the process. So let's see once again what happens if you don't get your wisdom teeth removed on time. Pain, crowding of teeth, repeated infection of the soft tissue that's behind the last tooth. You might have fluid-filled sacs that are cysts. You can have tumors. You can have damage to the nearby teeth. You can have gum diseases. You can have extensive tooth decay. These are not something which we really want. And getting your wisdom tooth is a wise thing to do if it is creating a problem or it is not coming in a good direction. So please visit your dentist and get your wisdom tooth evaluated to check if there are any complications associated with your wisdom teeth. Go ahead and do it now. So I'm Dr. Shilpa Rao signing out for today, and I will be back again with another video on dental awareness. In case you have any queries, please do drop in the comment section and I'll be very happy to answer you. In case there is something that you want me to talk about, that is also something I will be very happy to know, because anything that will help you get aware about the dental problems and the dental treatments is something which I'm always happy to do. I and my team at Sweet Smiles Dental Clinic are always ready to help you with any of your dental problems. We are at Viman Nagar, Pune, and we are your friendly dentists and the happy dentists. See you, bye-bye, and take care. Do follow us on our social media platforms, and you can also visit us on www.sweetsmiles.in. Take care and stay safe. Bye-bye.